the London Bridge Sports Medicine Podcast.
Medical news, health, fitness.
With Dr. Ajai Seth.
Hi there. Welcome to LBSM's Ask the Expert series. We put the important questions to our experts to give you the latest tips in health and fitness. Hi there. Today we talk to Maddie, a podiatrist and expert in gait and movement analysis. We talk about plantar fasciitis, why it happens and what we can do to get rid of it. If you're suffering with any of the signs or symptoms we discuss, please do get in touch to see how we can help. Hope you enjoy listening. Hi Maddie, welcome back.
Hello. Thank you very much for having me.
So good to have you back here. And today we're going to be talking about plantar fasciitis.
Yeah.
Lots of patients come in saying, I've been looking on Dr. Google and I've got plantar fasciitis. My heel is sore, and what do I do about it? So let's talk about it, plantar fasciitis, and let's firstly understand what it is. Give us a bit of a breakdown about what plantar fasciitis actually is.
So the plantar fascia is the area that is being discussed. It's a band of strong band of tissue which runs from the inside of your heel bone, and it goes all the way up towards the base of your toes. Each individual anatomy is slightly different, but essentially it runs from underneath your foot, and it can get strained, it can get pulled, it can get irritated, and causes pain directly underneath your heel or along that band of tissue.
And why does that happen? Why would it get irritated?
So it can be due to a number of different things. It can be due to a change in your exercise volume, your running volume, your intensity. It could be a link with your loading pattern or your weight, and therefore linking to obesity and putting on weight, anything that's going to cause an increase in load underneath your foot. A change in footwear. So often I see it coming into summer. People have worn trainers or wintry shoes through autumn and winter, and then coming into summer and you're wearing a flatter shoe or a sandal, and you're requiring more of your foot, and things like that can irritate it. And then also it can be due to your mechanics. So how your foot is functioning, how it's moving, and if there's features there that could be linking to your plantar fasciitis.
I often get patients who, may have a few factors that are causing it, but they'll come in and say to me, I've been this weight for years, nothing's changed. Why have I suddenly started developing heel pain? What would you say to them? Is there a good explanation of, why it's suddenly started to become flared or in pain?
There's usually a feature. So there's usually a change in something, whether that's I'm on my feet at work a bit more, or I'm now having to do this extra 20-minute walk in the mornings to get to work, or something that's changed, a loading pattern that has changed, or a footwear that's changed, or another injury. Often if there's an injury either on the opposite side of the leg or foot, you might have a bit of a compensatory effect. So you might start loading one foot or heel a little bit more, and then that in turn can trigger a response. The other thing is something else that's going on in the body, some sort of autoimmune feature or something else that's going on that could be triggering excessive pain. Something
medical that's causing the plantar fascia to be inflamed, and that's an important point, because people think they've got plantar fasciitis. It's not always plantar fasciitis either. There's other structures around the heel that can get quite angry and irritated. Like, for example, your Achilles tendon, or even issues with the heel bone can be quite angry or inflamed or stressed. So it's important to always make sure we've got the diagnosis right in the first place. So,
absolutely.
So let's just say, you've been to see the doctor or yourself, and we've been correctly diagnosed with plantar fasciitis. What can you do to get rid of it? What are the key things, the key steps to trying to get over plantar fasciitis?
So first things first, I always look at people's calf flexibility and ankle movement. Often if there has been a change in load or change in some sort of a pattern, the calf tightness might seize up, the calf might seize up, and you can get some tightness there. If we restrict some of the calf flexibility, that in turn leads directly into the heel bone and can help with reducing some of that tightness. So calf stretching is really important. Icing and resting can be important as well, just to reduce down some of the immediate pain. And then some things I typically recommend, if there is this calf tightness, because often it's like first thing in the morning kind of pain that's the worst, or once you've been at work, you've sat down and then you go up again making a cup of tea or something, that kind of getting up and down allows the plantar fascia to tighten, and then you're stretching it again, and that's the irritation. So when you're sat down before you get up, keep your foot moving, keep flexing your foot, bringing it towards your body, pointing your toes, keep it moving, doing some ankle circles just before you get up, either out of bed or out of your chair, can be very important. And then if you're in a lot of pain walking around the house, probably try and not be barefoot. Again, that's going to put more strain on it. So maybe being in a trainer or something whereby you've got a slight heel underneath your heel will be also certainly helpful. And then there's other things that we can discuss. If there is biomechanical things in nature, then that might be worth going and getting properly assessed by a podiatrist or physio or yourself, just to see what's going on more mechanically.
Okay, and yeah, I think footwear is important, because people often say, what shoes are best for me. But I think we've touched on in our other podcasts, actually, footwear is quite complicated, and it's not a one-stop shop for everyone. Different shoes will suit different foot characteristics. So the footwear actually may be an aggravating factor for plantar fasciitis, or it may be something that would help it. So it's always best to get professional advice on that.
Yeah, and looking at how old your shoes are, when you last changed them, is another feature that actually could have caused it. If you've been running in these running shoes for years and years and years, and then you've tried to increase your volume but didn't change your shoes, that's something to also look at, is the wear in them.
A lot of patients come asking me about medical therapies in terms of what can we do for the plantar fasciitis. And I always say to them, actually, you want to get the basics right first. So everything you've discussed in terms of the loading, how much force you're putting through your heel, calf stretching, calf strengthening are the key things. And medical therapies have their place, such as shockwave therapy or injections, for example. But actually, if you're not getting the basics right, often you may temporarily help the pain or the inflammation, but it will just come back. And do you see that a lot?
Yeah, absolutely. If we're not actually addressing the main features, the inflexibility or the weakness or the mechanics, then likelihood is that you're going to go and increase your running volume again, and then it's going to come back 6 months later. So definitely getting the basics right is so important. And working out what was your trigger as well, trying to pinpoint what it was that caused the irritation the first time.
Brilliant. Maddie, thank you so much. If anyone's got any issues with plantar fasciitis, wants to find out more, I'll put your details in the comments below, and they can get in contact with the clinic and go through that way. But thanks once again, and we're going to have you back very soon, I'm sure, to talk about all things podiatry.
Absolutely. Thank you.
Cheers.
Bye.
Thank you. Bye. Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you, or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again, and see you soon.